So the topic of today's talk is physical activity, what's new? And I think this increased interest and emphasis in breast cancer survivorship is a fantastic thing because it means a couple of things to me. Number one, it means that women are living after breast cancer diagnosis and living for longer periods of time, so much so that survivorship is being elevated in terms of being a priority in healthcare. And it also means that healthcare professionals and healthcare providers are aware that there are some unique needs and unique experiences that we have to pay special attention to in terms of breast cancer survivorship. So according to the American Cancer Society, there are currently roughly 3 million breast cancer survivors living in the United States. And that's due to several things. Two of the main contributors to that success is early detection. In general, early detection does lead to better prognosis and survival outcomes. Also, we've seen tremendous advances in treatment, and as Dr. Ferrero talked about earlier, we're on a trajectory to continue to do great things. So we expect the number of survivors to continue to grow. So with this growing number, breast cancer and survivorship is starting to be viewed as more of a chronic disease, and we're thinking about managing breast cancer from the time of diagnosis throughout survivorship in ways that we manage many other chronic diseases like hypertension or diabetes. There are efforts within the research community to establish evidence-based recommendations for survivorship plans. People are increasingly being encouraged to talk with your physician, talk with your team about your individual survivorship plan. That may mean medication, that may mean lifestyle modifications, but again, that's going to be highly individual. Because what we're really talking about here is a new normal. So one of the speakers last year, I believe it was the young survivor who provided some insight last year, talked about her life in terms of life BC and life AC, so before and after cancer. And that really resonated with me and stuck with me so much so that it immediately came to mind in preparing this talk, because I understand that a breast cancer diagnosis can really be a defining moment in one's life. But as we've heard from our wonderful speaker this morning, our survivor, we understand that it's what you make of it. So we just have to do the best that we can every day and make sure that life after cancer or life AC is as fulfilling as possible. Because even with these advances in treatment, helping people to live longer and survive, we do know there are still opportunities to further enhance survivorship. I remember talking to a professional colleague a couple years ago about a family member who was dealing with an unrelated medical situation and just asking her advice to get second opinions about some decisions to be made. And she told me, Tiffany, through medical advancement and technology, we can keep people alive, and we can keep them alive for a fairly long time. But what we need to be more concerned about is, how is the life that they are living? What is the quality of life that they are experiencing? So that's one of the main things that we want to focus on in terms of survivorship, is how can we help people to live not only longer lives, but fulfilling lives as well. We have opportunities for enhancement here in terms of physical and physiologic function, as well as in more psychosocial domains. So when we talk about physical factors, I know everyone would appreciate, reductions in feeling fatigued and minimizing cognitive impairment, particularly among young breast cancer survivors. Concerns about fertility may still need to be addressed, and what can we do to continue to maximize options for fertility. Of top priority, of course, is that we want to prevent recurrence of breast cancer, and we want to prevent the development of secondary cancers and reduce death, both from breast cancer and other causes. Now, in terms of psychosocial factors that are equally as important when we think about quality of life, we want to do what we can to continue to enhance and improve body image and sexuality. We want to help individuals to lower or manage their stress, and also lower reporting of anxiety and depression. So I have a question, and there's the answer. What can you do? So again, from research, we're learning a lot every day. But one thing that is pretty well established, and I'm glad that Dr. Ferrero set me up very well earlier for this talk, is that we know you can get moving. You can exercise, you can be physically active. And the reason that I have the word you underlined and bolded is because I want to put the emphasis on you. It is a choice for you to make, and exercise often makes people feel empowered and strong, and it's something that you can have control over, possibly at a time when you feel like with cancer you don't have much control over what's going on with your body. So take this opportunity to become active, to get moving, and love yourself and love your body. So before we go any further, I guess I want to get kind of a gauge of the room. How many people in the room would say that you are currently physically active on a pretty regular basis? Just by a show of hands, and we can be honest, no judgment. Well, that's good. So it looks like we have a lot of active people in the room, so that makes this job of mine a lot easier today. But hopefully there'll be some reminders and just some things to help you with moving forward. So when we refer to physical activity, we're really talking about any body movement that's involving your muscles, and it usually requires more energy than resting. And we tend to kind of think of this in two buckets: aerobic exercise, which is often referred to as cardio, and resistance exercise, and some may refer to it as strength training. But I want to be clear that exercise is only one component of physical activity. It's kind of that structured movement, but there are ways that you can increase your physical activity throughout the day besides exercise, just through your usual activities. Most of this talk will focus specifically on exercise, but we'll talk a little bit more about just building physical activity into your routine throughout the day. So when we talk about aerobic exercise, we mean any activity that's using your large muscle groups. It's sometimes rhythmic in nature, but not always, and you kind of do it on a continuous basis. You're going to lead to a little bit of an overloading of the heart and lungs so that it's working a little bit harder than at rest. With an aerobic activity, we think about two levels of intensity. So there's moderate intensity with aerobic activity, and that's going to be things that lead to a slight increase in your heart rate, a slight increase in breathing, but you could still pretty comfortably hold a conversation while doing moderate activity. So something like walking. When we think about vigorous activity, we should start to think about things that require a little bit more work and may get us breathing a little bit harder and get our heart beating a little bit faster, and it might be a little bit more difficult to hold that conversation, and you definitely should not be able to sing a song if you're engaged in physical activity. I can't sing a song if I'm standing still, but definitely should be able to in vigorous activity. And then we also think about resistance training, which is where we're just targeting exercise to a specific muscle or specific muscle group against some external resistance. And we'll talk a little bit about that as well. So how much activity should we be doing? Well, current recommendations put forth by the American College of Sports Medicine and fully endorsed by the American Cancer Society recommend that we should aim for a minimum of 150 minutes per week of moderate activity or 75 minutes per week of vigorous activity, going back to those definitions that we talked about, or some equivalent combination of the two. It's important that this activity is spread out throughout the week. People generally recommend 30 minutes per day for 5 days a week, rather than trying to do that full 2.5 hours in one day. And then the most important thing is just to remember to also engage in the activity in bouts of at least 10 minutes at a time. So you may not be able to do 30 minutes of walking at one time, but if you can do 3 10-minute bouts, research has shown that the benefit is equivalent. In terms of resistance training, ACS and the American College of Sports Medicine have also put forward specific recommendations for breast cancer survivors in terms of resistance exercise. And the point is that you want to do something, but start with a supervised program with little resistance, and then progress over time. And you probably want to do that in consultation with your physician or your team. So in thinking about what kinds of activities, I just put these pictures up here just to kind of give you some things to think about. But the most important thing, again, going back to what Dr. Ferrero mentioned earlier, is just do what you like. Find what you like. So most of the research is in the area of walking. We typically tend to start there in the research arena because it's fairly safe, it's pretty easy to get people to do, and it's pretty inexpensive. And there are substantial benefits achieved with walking. So if that's what you want to do and that's what you can do, do it. Don't feel like you have to join a gym or any structured exercise class. Walking does just fine. However, if you don't like walking and you rather dance it out, find a Zumba class, turn up the stereo in your basement. Do people still have stereos? Anyway, turn up the music in your basement and just move. The important thing is that you move more. So here you see people cycling, running, swimming, doing a little bit of strength training, and the important thing is just that you're moving. Safety is often a concern when people engage in physical activity. So I have posed a question, when is it safe to begin physical activity? And the answer really is yesterday. Like it's never really not a good time to start being active. So for those in the room who are currently active, keep it going. For those who are not active, consider starting today. Even if you are actively in treatment, physical activity is still recommended. You may be advised to do lower levels, you may not be able to do as much, but the point is just to do some movement every day. Even during treatment, it helps to maintain your strength and endurance and flexibility. And it's also very helpful for you to do stretching along the way. Again, I also reiterate, just consult with your physician along the way, but I can guarantee you that they will tell you to try to do some moving every day. After treatment is completed, we advise people to, incrementally do what you can to reach that recommended goal of 150 minutes per week of moderate activity or 75 minutes of vigorous activity for the real trailblazers. And there are tremendous benefits associated with physical activity. Dr. Ferrero mentioned some of them earlier, but I'll just run through this list in terms of physical aspects. So physical activity has been associated with reduced risk of breast cancer recurrence. That is supported by scientific evidence. Physical activity has been associated with a reduced risk in breast cancer specific death. That is supported by scientific evidence. That should be enough to encourage us all to get moving or stay moving. In addition to those things, physical activity has been associated with improved physical functioning, reduced fatigue, and I know that sounds counterintuitive. It's hard to kind of get up and start moving if you are already kind of overburdened with fatigue. So some of it is going to be mental and having that good social support to just get yourself moving, and eventually you'll start to feel a little bit better and manage the fatigue better. Physical activity has been associated with reductions in lymphedema and risk for lymphedema. Obviously, physical activity is associated with weight control, and that's what we often think about when we think about physical activity. And whereas that's a good benefit of physical activity, I just like to remind everyone that you still receive benefits to your body, even in the absence of weight loss. So a goal of yours may not be weight loss, or it may be weight loss and you're exercising and still don't see any weight loss. Don't get discouraged. Trust me, your bodies are still happy that you are getting some movement and being physically active. And also, again, physical activity has been shown to increase energy. In addition to all of these tremendous physical benefits that I know are very important, we have to think about psychosocial benefits as well. Because again, survivorship is about the whole person, and we've heard that today. It's not just about getting through treatment. It's about the lived experience after treatment. So research has shown that individuals who are more physically active tend to report higher quality of life than those who don't meet recommended levels. Activity has been associated with improved body image and improved sexuality, as well as reductions in anxiety, depression, and physical activity is often recommended as a form of stress management. So again, in addition to the physical benefits, there are tremendous psychosocial benefits, and I encourage everyone to just think about that in terms of becoming more active. So I want to give you a few practical tips for staying active. I know it's easier said than done, but the first thing I would do is just encourage you to make it a habit. So kind of figure out what works well for you. You may need to put it on your calendar. You may know that you're more likely to do activity if it's in the morning instead of in the evening, or vice versa. Just figure out what works for you and make it a habit. It's non-negotiable, it's not optional. So after you do it over a certain amount of time, eventually it will just become a part of your regular routine. Again, I would say find something that you enjoy, because if you don't like it, you're not going to do it. So if you don't like running, don't go running. And you probably won't anyway. You might that first time, but then after that, you probably won't stick to it. So I encourage you to find something that you like, and then it's not even really like you're exercising. It's just you getting some enjoyment. Also, build it into your day. So one thing that works well for me is using walking as active transport. So I work at UAB. There are restaurants all around. On days when I don't bring my lunch and I have to go find food, I opt to try to walk to the restaurant if the weather permits. And when I really think about it, if I walk 15 minutes to the restaurant and 15 minutes from the restaurant, I've gotten my 30 minutes in for that day, and I didn't even feel like I exercised. So we have to use these tricks for ourselves, and hopefully I got a good but healthy lunch somewhere in between. Also, again, don't hesitate to do short bouts, and this is going to be important if physical activity is new for you and maybe feeling a little bit overwhelming. 10 minutes of activity 3 times a day, or 2 15-minute bouts each day, they add up and they work just as well as doing the full 30-minute recommendation. And then finally, I encourage all of you to just use what you know about engaging social support. I wish the men were in here today, but you can go back and tell them that you need them to support these efforts. Having someone there for accountability, having someone there just to make it a little bit more enjoyable really goes a long way in making sure we remain active. So, I was charged today with talking about what's new in physical activity. I'll give you a little bit of my thoughts. In terms of what's new about physical activity, I will honestly say not much. And I'm saying that after convincing you to listen to me ramble about this for the last 10 or 15 minutes. But physical activity generally has been and always pretty much will be a good thing. And there's nothing really new there. But I get excited because we are learning a lot more about physical activity. So when I think about what's new and what we know about physical activity, a lot. We're starting to have more research to support distinct benefits of physical activity for breast cancer survivors beyond what we know just about the general population. There are benefits not only to physical health, but also psychosocial health, and it's safe during treatment and beyond. I also get really excited because this is a really growing and emerging area and we're learning more daily. I think the future research directions include more in-depth looks at subgroups that may not have been included in some of these earlier studies so that we can learn and address those questions. And also research is also starting to look at different modes of exercise. So I know there's at least one group that's kind of looking at, does Pilates give it a different effect than walking versus yoga? So just be on the lookout for those things and, you know, opportunities to get involved in research as well. And then finally, what's new in how we think about physical activity? And I would say hopefully something. So again, it looks like probably over half of this room already engage in some level of regular activity, and that's a great thing. And I want to encourage you to continue to do so. But I hope that something from this talk makes us all feel inspired and has taken away any fear or apprehension that we have about being active, and has either provided some new motivation or renewed motivation for us to get moving and be active. And finally, I'll leave you with just a few resources if you want to go back and review some of the things that I presented today, or look even deeper as well. So the American Cancer Society and Susan G. Komen Foundation provide great resources on physical activity, as well as the American College of Sports Medicine, which is not cancer focused, but is kind of the leading authority on exercise and physiology in the US, and they do some disease specific recommendations, so it's worth taking a look there. Also, the Young Breast Cancer Survivorship Network, as I'm sure all of you are familiar with, and Survive AL, and my little thing is a little bit in the way, but Survive AL also provide great resources on physical activity. And then finally, a little bit of a shameless plug to invite you to follow me at Dr. Tiffany Carson on Twitter. And it's not as much of a shameless plug as it appears to be, because I do try to disseminate new important research findings and information that we learn. So that can also be a resource, and you're welcome to tweet me as well.